Imagine you were born into silence. Imagine that kids at school made fun of you just because you were different. Imagine that teachers told you you were too stupid to go to school just because you couldn't hear. That is the reality of over 180 million children around the world. At Worldwide Hearing, we're a nonprofit that's not just about better hearing. We're about connecting these children to their world so that they can have access to equal opportunities. So let me tell you a little bit about the numbers. There are 1.3 billion people who suffer from hearing loss. About a third of those suffer from disabling hearing loss. Almost all of these people live in developing countries, and almost none of them have access to the hearing aids and the services they need. Why? Hearing aids remain very unaffordable at an average price of $3,000 a unit. There's also a lack of trained personnel to fit them. In Guatemala, there is one audiologist for the whole country. She happens to be trained here at McGill University. In Honduras next door, there are none. There's also a lack of data in these countries. Everybody is collecting data in silos. Data is not getting aggregated on hearing loss, so even our numbers are not great in this field. So as Worldwide Hearing, we're a nonprofit, and our goal is to provide access to affordable hearing aids and screening services, mainly to children and youth around the world. When we started our journey, we were really focused on the hearing aid provision. So we built a model called Hearing Express. And with this model, the goal was to reduce the cost of provision by over 80% relative to the status quo, and to work outside of a clinic and work in the communities. We trained local people, men and women, mainly women, and we empowered them. These were women that many of them hadn't even finished high school, but that were empowered to use technology, mobile tablets, to be able to bring hearing care directly to their communities, to do hearing aid fittings, hearing aid screenings, and all the follow-up care. Thanks to a support by Google.org, we expanded a lot of our services to include mass screenings in schools. There we used other mobile technologies, like the technology you'll see here, which is a mobile otoscope that allows to see what's happening in the ear. We had an audiometry tool we worked with, and we decided, hey, audiometry, this is a way of doing hearing tests. Why isn't this stuff in the cloud? We said, this is really important to start aggregating data. So we built it. And then other questions came up and said, okay, well, what about the data? Because even the World Health Organization, we work with them closely, doesn't have great data on hearing loss. So if we really want to move the needle forward, we have to get better data, and we have to start aggregating the data in one place. So we built the Global Hearing Loss Database. This is a project to be able to aggregate all the data on prevalence and outcomes in hearing loss. So I'm going to give you an example here. This is basically a map of every single prevalence study done on hearing loss around the world. And we've mapped it for the first time in a Google map. And when you click on the dots, you can actually see data in a comparable format for the first time. We then mapped every single prevalence study ever done in an Indigenous community right here in Canada. It was a very interesting project, but then the question that we asked ourselves is, and so what? I mean, data is great, cloud connectivity is great, but how does that really change social impact? How does that really help advance the field of hearing loss? Well, I'll give you a couple examples because it's been really a fascinating journey. I was in Nunavut a few months ago, and we're working there on a project with the McConnell Family Foundation to train local people in their communities to provide access to hearing care. And the government was asking me, well, what's the data on hearing loss? We don't have great data. I said, well, that's really interesting you asked that question because we just mapped this stuff, and here's the link. So now for the first time, the government's telling us, well, if we want to make the case for more audiologists up north, we need to make a business case to the Ministry of Health and ask them for, we have to know the prevalence rate. And I said, well, here you go. You can quote from these studies. There have been multiple studies done up north. So I just want to give you a concrete example of how data you can start using data for public policy and for increased interventions. We as a nonprofit, we're very action-oriented and field-oriented. So we want to see how we can use this data to drive things forward. I want to just talk briefly about up north in Canada because this is part of our strategy of reverse innovation. We've done a lot of work abroad in places like the Philippines, Peru, Guatemala, Jordan, Vietnam. And as we were doing these things, we were saying, well, if we're able to reach these remote communities, a lot of these same dynamics are happening up north in Canada. You may not know this, but the Inuit communities of northern Canada have some of the highest rates of hearing loss in the world. One report shows that 30% of Inuit children have some hearing loss, compared with only 3% in the south. That's enormous, and it's right here in our back door. So we said we have to do something about this, and so thanks to support, we're now operating a project up north as well. Some of the reasons, because I get asked this a lot, are things like there's a congenital predisposition to ear infections. This leads to, also other environmental factors, overcrowding in homes, poor nutrition, that really exacerbates the hearing loss. Another project we've worked on as we were building the global hearing loss database is we're building the WHO's data collection app for prevalence on hearing loss. Because, again, this data was being collected in silos, and we said, what if we had one tool worldwide to start collecting this data? And obviously all kinds of benefits to that, facilitating data capture, project management, reducing data entry errors, et cetera, et cetera. And this might not sound revolutionary to the people here in the room, because I think we're all very online about this, but for our field of hearing loss, this was truly innovative. Very little is being captured in the cloud. Finally, I want to tell you the story of our most recent project called the Teleaudiology Cloud. We recently won the Google.org Canada Impact Challenge. So we were one of 5 organizations in Canada that won a $750,000 grant to build this project. We're actually the only Quebec, I think, based organization. And the project is really about making distance disappear. How can we connect that child in a far-off community to the audiologist they need to connect with? How do we connect them to speech therapy and rehabilitation? This project will do all that. And so we're just initiating in this 3-year project, and we're very excited about the next steps. As we're sort of wrapping up, I want to tell you the story of this young man that I met in Jordan. His name is Maher. He was 16 when I met him. And when I met him, he was very shy and reserved. We fit him with a hearing aid, and I had the chance to see him a year later. And, he was a completely different person. He was smiling, he was joking, he was really outgoing. And the technicians that had fit him, our female technicians, told me that he now had a girlfriend. They were teasing him about that, and that he had learned how to do carpentry and was selling his artwork in Amman to earn extra income for his family while he was going to school full-time. And I just want to share that story because at the end of the day, it's not just about hearing, it's really transformational for a young person to have access to hearing. So again, we hope our goal over the coming years is to connect many more children to their world through hearing. Thank you very much.